So we've been doing some great exercises, but I think it's time to get into some of the anatomy of what tissues are involved in pelvic pain. So we have underneath the pelvis, this is the rectum. Here are your sit bones. Here's the center of your perineum. And these muscles, everything you see on this model that's red, that represents skeletal muscle. It's the same thing that's in your bicep, except this controls your sexual function, it controls your urinary function. And you see these nerves here? When these muscles are tight, these nerves are not happy. And so that's why we're exercising, trying to get blood flow to these tissues. And now I'm going to teach you some things that were instrumental in overcoming pelvic pain in my own journey, and what I help a lot of men with in overcoming their journey as well. So we're side lying, okay? And giving you a view of the inside of the pelvis here. Here's your bladder, okay? Here's your colon coming down into the rectum, okay? So, and everything you see in red, again, those are skeletal muscles. It's the same thing that's in your bicep. They respond to exercise. They respond to massage. So we're gonna just take those parts out. Hopefully we can put them back in later. And then here's the rectum, okay? We're gonna just draw that out of the way to show you exactly what areas we're gonna be impacting with the TheraWand. So before starting, you make sure that your TheraWand is clean. I suggest using gloved hands just for cleanliness, and then use sterile medical lubricant on the tip of the TheraWand. And then you might hold it just, let's say, about 2-3 centimeters away from the tip. And you start on the first time you try this, you're just gonna basically get to the entrance of the rectum. And that might already be pretty uncomfortable, might be painful. Anytime that we're finding a painful point, that's likely that it's a trigger point. And these areas, you're basically just needing to touch them at first to do therapy. And again, if any of these areas are painful, comparing that to, let's say, touching your bicep, again, it's the same muscle. So if this area is tight and inflamed and not even tolerating any touch, well, again, that's a good thing that we're addressing these tissues. So if you're finding things that are uncomfortable, it's probably the way forward. But we're gonna make sure that we're practicing with gentleness and breathing and trying to relax the whole body as we're practicing. So as we enter into the rectum, and you're able to relax the muscles of the rectum, again, each time that we are deciding to go farther into our treatment, we're assessing our comfort level, we're assessing our breathing, and before going deeper, we're just assessing, have we addressed all the tissues at that depth? So we've got 3 main variables in this treatment. We've got depth, which is how far we are inserting the TheraWand into the pelvic floor. We've got pressure, which is how gentle and basically never pushing hard at all. And then we've also got tilt, okay? We've got tilt in position. So let's say on this first couple weeks of your home therapy, you're just gonna focus on inserting the device, pushing straight down towards the table with just very light hand pressure until you feel a gentle stretch on the pelvic floor. Drawing up, because then that's addressing the muscles on the top side of the pelvis, which would be here. Okay. And then, so what we're trying to do with the device is basically through the rectum, you're trying to gently perform trigger point release through these locations. And so you're gently stretching into the muscle tissue through the rectum, which is a very resilient tissue as long as we're going at this gentle pace. And so all the skeletal muscle of the levator ani muscles can, let's say, benefit from this therapy. And so this Therawan can go pretty deep, but we're going to take some time to get there. This process takes a long time. So give yourself weeks, months, and go at the pace of what you're feeling. And then as you get more confident, that's when you can start to tilt the device. So first, we simply insert the device and apply downwards or upwards pressure. Then we start to turn the device so that the point is actually focusing your hand pressure on the pelvic floor muscles. And then to apply more pressure or to change the concentration of your pressure, you can tilt the device. Basically, you're tilting the handle away from where the point is performing therapy. Okay? And so, again, this process takes a lot of practice. If on the first few goes that you feel like it's pretty uncomfortable just to get inserted, that's okay. Seek out a local physical therapist if you have questions on this, one who specializes in pelvic floor dysfunction, and let's say stay the course.